My name is Shelby Criner, and I'm a California FFA Proficiency Finalist for Veterinary Science. My SAE project consists of my placement position at the Modoc Veterinary Center. Growing up in an agricultural setting increased my interest in veterinary medicine. By processing our cattle, I got to know our local veterinarians and was able to obtain my position at the veterinary center. I have always wanted to be a veterinarian, and by gaining knowledge through hands-on experience, my passion for veterinary medicine has increased greatly. When I first started working at the clinic, I was cleaning kennels and walking dogs. By gaining experience, I have been able to participate in other activities like ranch calls to semen test bulls and tending to calves after emergency C-section surgeries. Our clinic experiences lots of production farm animal patients. During the fall, our veterinarians are out on ranch calls frequently to trick and semen test bulls, preg check cows, and bangs vaccinate heifers. Ranch calls and work with large animals like horses are by far my favorites. In addition to large animals, our vet center also sees all household pets and animals, like a variety of sized dogs and cats, which I enjoy working with those animals as well. With the small animals, I weigh them and help restrain those animals for blood draws, exams, and treatment. I clean kennels to keep up with clinic cleanliness and maintain animal comfort. Overall, my knowledge of veterinary medicine is constantly expanding. I have grown my knowledge of veterinary terms and correct dosage due to the amazing veterinarians and vet techs at our clinic. I plan on continuing with my position at the clinic until I graduate. I look forward to all the new experiences I will gain.
Explain the roles of the veterinarian, registered veterinary technician, and vet assistant in the practice where you are employed.
At the practice where I'm employed, the role of the veterinarian is to examine and determine the animal's health status, and upon that, making a diagnosis of their health. They also perform surgeries like spay and neuters, orthopedic bone surgeries, and complete C-sections on cattle. They also prescribe medication and administer vaccines like the rabies and brucellosis vaccine, also known as bangs, which can only be administered by a licensed veterinarian. The role of a registered veterinary technician is to complete the initial exam on the animal by taking vital signs and drawing blood if needed. They also complete laboratory procedures like running blood work. They assist in surgery prep to help the veterinarian. They administer medication and vaccines prescribed by the veterinarian, and they help with taking x-rays. The final role of veterinary assistant is to feed and care for animals, restrain animals during exams, clean cages and kennels, and assist veterinarians during exams.
What has been the most unique experience you have had since working with this SAE?
By working at the veterinary center, I've been exposed to many different animal experiences. The most unique one by far to myself was going with the veterinarians to process the Wild Devil's Garden horses. Each fall, the stud horses must be castrated, and each horse must be processed and have a negative Coggins test before they can be adopted. I went with our veterinarians and assisted them by drawing up the proper dose of antibiotics, handing them the correct tool they needed to complete the castration, and filling out various forms of veterinary paperwork. This was the most unique experience to myself because not many people are involved in processing wild horses, and it benefits our local rangelands and ranchers.
What are 3 safety protocols you follow when working with animals in a veterinary setting?
3 safety protocols I follow while working with animals include approaching all animals with caution. By avoiding their blind spots and talking slowly to them as I approach, I can make sure to keep them calm and comfortable while avoiding sudden movements. I also take precaution against zoonotic diseases like rabies and ringworm. By knowing the signs of infection, which includes scaling, crusting skin, and loss of hair for ringworm, and foaming at the mouth for rabies, I can use protective gear like gloves and gowns to keep myself and others safe. Lastly, when restraining animals, I make sure to hold the animal in a position where they cannot harm myself or the person completing the exam or procedure. I can do this by holding the animal's head away from the person completing the procedure and, say, for an intravenous injection, holding off on the leg for the person trying to complete that.